So there was some interruption. I'm readmitting all of them. Okay, so here I'll be sharing the video of this. Okay, so no, nothing to worry. You'll get the recorded part. Okay. So here I was trying to explain one of the key concepts which we missed in the last class, that is additive effect and synergism. Okay, so additive effect, when the two drugs are given together and their total effect is equal to the sum of the individual action, ephedrine plus theophylline. Here the drugs with different mechanism of actions are given, that becomes additive effect. Here 1 plus 1 is equal to 2. Remember, ephedrine plus theophylline in bronchial asthma, it is 1 plus 1 is equal to 2. Similarly, we have one more combination, that is summation. Okay, in case of summation, the drugs with same mechanism of actions are there. Okay, so here it can be diclofenac plus paracetamol, diclofenac plus acyclofenac, or diclofenac plus another NSAID will be combining. That will be summation is with same mechanism of action, two drugs are combined. Okay, in case of synergism, we are combining two drugs with different mechanism of action, where 1 plus 1 is not equal to 2 but more than 2. Okay, that may be 1 plus 1 is equal to 5, 1 plus 1 is equal to 10, like that. In case of synergism, the popular example is sequential blockade of folic acid, which we use in case of antimicrobials. Okay, what are those drugs? Sulfamethoxazole plus pyrimethamine. Sulfamethoxazole plus pyrimethamine, we combine it in case of drug resistant malaria we are giving. Okay, so and we have one more combination, that is sulfamethoxazole plus trimethoprim, that is cotrimoxazole. Okay, cotrimoxazole, that is a combination which we use. Okay, so synergism, two drugs given together has more action or synergistic action. Okay, so one more concept here is the drug antagonism. Okay, so one drug opposing or inhibiting the action of another drug. Okay, so chemical here chelating agents inactivate the heavy metals. For example, lead and mercury by British anti-Levi. Physiological antagonism, which we commonly use to treat the toxicity due to anaphylactic shock, we use adrenaline in case of anaphylactic shock. Okay, so reversible antagonism, we have acetylcholine and atropine. In case of irreversible antagonism, we have this adrenaline and phenoxybenzamide. Okay, so that is at the alpha adrenergic receptors. Okay, so we have non-competitive antagonism. Okay, so I will give the recorded version, or I will post the class again. Okay, don't worry, just be in the class. Okay, so here G6 phosphate deficiency is important. Okay, so in case of this primapen is a drug which we commonly use in case of radical treatment of malaria. Okay, and this drug should not be used in case of pregnancy. Primapen should be avoided in pregnancy. Rather, we go for chloroquine in case of this pregnancy. So if we use it, there can be G6 phosphate deficiency and followed by which the toxic reactions are expected. Okay. So genetics can alter. Okay, there is a wide list of what are the drugs which can cause various type of reactions when they do not have the sufficient amount of enzyme which can metabolize. Okay, in case of ketogol O-methyl transferase deficiency, levodopa is not metabolized. Once levodopa is not metabolized, there can be enhanced action of the dopamine. Okay, so dopamine enhanced action, the person can show some of the symptoms of Parkinson, this psychotic disorders. Species and base, we have discussed that blacks requires higher concentration, Mongols require lower concentration of atropine and ephedrine. Okay, so route of administration, we have discussed that intravenous is the ideal route, oral route we can have delayed functions. Okay, and intravenous route also comes with the toxicity which can kill the patients in seconds. So environmental factors, that is exposure to insecticides, pneumoconiosis can occur in the occupational hazards. All these things are there where we should be careful in which area we are there and from which area we are getting the patients. What may be the environmental factors which are influencing the person. So pregnancy as a hyperdynamic state, we have explained that here the babies are exposed during the late phase of the pregnancy, that is around 8 to 9 months. The exposure to the give drugs administered to the baby will be more because placental aging has occurred. And in the early first trimester, what can happen is the organogenesis will be there, and we should be worried about the teratogenic effect of the drugs, and we should be careful in using that. Okay. So coming to the pregnancy drug effect on the fetus, okay, highly lipid soluble drugs, for example, this 5-pentyl sodium, if it is used in case of pregnancy, what can happen is the baby may go for apnea and all. So coming to the next part, placebo and nocebo. Okay, so this placebo and nocebo, though they appear simple topics, these are the agents which we use in the clinical experiments, and these forms very important part in deciding which drug comes into the market and which drug should not come into the market. So what we do is we label different groups, and some patients we can give this placebo, some patients we can give the ideal drug, and some patients we will give the new drug which has come into the market. So the ideal drug will, for example, we'll take it as paracetamol, which can reduce the fever. And one sugar tablet which we have given, that placebo, it can also decrease the fever, but it will not be able to reduce the fever as much as the paracetamol. And the newer drug, we should be able to get the same amount of decrease in the fever. And the newer drug which we have used may be the X drug. The drug X may be used at 50 milligram, which may be able to show the effect of paracetamol, which is commonly used at 500 milligram. Now the new drug becomes highly efficacious at 50 milligram. Now the paracetamol cost is 1 rupee, and the new drug's cost is 10 rupees. Even though the drug becomes efficacious, it may not come into the market because of its high cost. Okay, so now the new drug should be able to produce the effect at lower cost. For example, 10 paisa, if the drug is able to produce the same effect as paracetamol at 50 milligram, then the drug becomes new drug for fever. Okay, so as simple as that. Okay, so we have to compare the drug effect with placebo first. Then if the drug is able to produce the effect better than placebo, then we have to compare it with the ideal drug. Nocebo effects are seen when the patient has no faith in the doctor, who is forcefully come to the doctor. Okay, so he doesn't trust doctor, and he is very much in confidence with the old doctor he was showing. So most of the time it happens to the old patients who are in 50s and 60s who are showing to the old doctor, and they have moved to the new place. Now the new doctor they are showing, and whatever the amount of drug or whatever even if it is the same drug the previous doctor was prescribing, now the patient is not satisfied and the person's hypertension or diabetes has not come into control. That is the negative effect which the patient has created for himself. That is nocebo effect. So these are the agents which are tried in clinical experiments. Okay. So some pathological state we have discussed that if there is GI disturbance, okay, amoxicillin itself can cause GI disturbance, achlorohydria, all these things will alter the response of the persons. In case of liver disease, for example, alcoholic liver cirrhosis, the metabolism of the drug will be increased. Okay. So coming to the other pathological states, for example, in kidney disease, nephrotoxic drugs. So we should remember amphotericin B and aminoglycosides. The two A's are highly nephrotoxic drugs, and these drugs should be used in caution with the patients with chronic kidney disease. Chronic kidney disease, ideally, usually it will be due to the diabetes or the nephrotic syndrome which has occurred. Okay. Pathological state, that is congestive cardiac failure. For example, if you use this procainamide and hydrochlorothiazide, if the drug itself is not reaching the ideal uh, working part, for example, in case of this hydrochlorothiazide, the drug should actually reach the nephrons, where it should reach the ascending duct, where it should be working. Okay, but if the drug is not able to reach that site, it will not be active. In case of congestive heart failure or congestive cardiac failure, it happens that the drug may not be reaching the site because of congestion. In case of hyperthyroidism, the person is hypertensive, more sensitive to digoxin, all these things can happen. In the other case, what can happen in case of hypothyroidism, the person is less responsive to the drug, the person is under depression, the serotonin levels are less, there the person will have other types of problem, constipation and that. So pathological states, various pathological states are there. Okay, so which can bring about the various type of reaction. One more concept here is the accumulation. So what is this accumulation? Accumulation is if we go on giving the drug can go on accumulating within the body. The ideal example we are given here is digoxin. So digoxin we are giving dose holiday. Dose holiday is for 2 days. Okay, so 5 days in a week we give digoxin because the digoxin is a drug which tends to accumulate in the body. Once the drug accumulates, the person becomes hyper responsive to the adrenaline or the other drug which the person is giving, and the drug itself is an arrhythmogenic drug. So tolerance we have told about naturally acquired, natural tolerance, acquired tolerance, acute tolerance, tachyphylaxis. All these we have discussed. Okay, so this is in brief what all the things are there. If you have any doubts, you can ask me. I'll give you the link for this videos which we have recorded. If you have any doubt still, then I can reschedule the class again. Okay. So thank you so much.